Murang'a County, 2 of the 7 sub-counties in this region are under watch, and for a healthy reason. Many children under 5 years of age have been learning a new song.
Vitamin A, bodyguard, is my body strong, strong, strong.
The Vitamin A Bodyguard song. The lyrics: Vitamin A Bodyguard makes my body strong and strong. It helps me not to get sick, so I can run, have fun and play. Nutritionists have known where to cast their efforts.
We concentrated with the schools, all the schools that had children going to ECD, Early Childhood Development Centers. So we issued them with vitamin A, and majority of those children were between 2 to 5 years.
Vitamin A is essential for the development of the brain. This mineral therefore enhances children's learning ability. Besides, it boosts vision. Supplementation of this vital mineral improves resistance to disease and therefore cuts down mortality rate. 5-year-old Murang'a hasn't forgotten who administered the capsule to her. She loves the reason given. Jerry in pre-primary 2 hasn't forgotten how it was done either. Early Childhood Development Centers, ECDs, have proved effective in scaling up vitamin A supplementation. This program began in March 2018. The thrill of turning out strong now is just irresistible to these young ones. Their teachers lead them in flexing their muscles.
Let's sing together, vitamin A, bodyguard,
Healthcare workers in the county have been alert so as not to miss any child.
The Murang'a County government, together with the partners, did a gaps assessment for vitamin A. After realizing that the coverage for vitamin A has been suboptimal for many years consecutively. So the gaps assessment outlined our major gaps, and so CBCC Africa came on board to work together with the county government to bridge those gaps and ensure that every child receives vitamin A.
The focus was on Murang'a South and Kandara Sub-counties. Vitamin A supplementation in Kenya is policy guided. Nutrition International is one of the partner organizations that came on board to effect dissemination of the vitamin. Nutrition matters are repeatedly taught in schools in Murang'a. At Kahaini Primary School is a girl in pre-primary 1 who brought her head teacher an alternative source of vitamin A mango. The girl is on the road to grasping nutrition matters better. Some pressure has been eased off parents' shoulders.
The parents are happy that they are given centrally. So once they are administered here, they are sure that they have been given.
The aim of the project has been clear.
One of the broad objectives is to ask ourselves and to come up with evidence of what does it take to scale up vitamin A using multiple channels, looking at which channel is more effective, which one is delivered more, and how much does it cost to deliver vitamin A.
For babies between 6 and 11 months, the most successful channel was the static health facility. As mothers kept streaming in with the young ones for routine clinic, the opportunity to administer vitamin A would be seized. Growth would also be monitored.
The vitamin A supplementation coverage in Murang'a was very low, in the region of about 30%. And one of the questions that as Nutrition International we kept on asking ourselves is that we supply enough capsules, but you find the coverage is very low. So the question that lingered in our minds was, what keeps this coverage this low? Why does the coverage still remain low, yet the supplies are adequate? So this is one of the things that led to the push to change the policy so that you can expand the delivery mechanisms for vitamin A.
Health officials in the county are convinced that there has been a turnaround.
We have a success story in the 2 sub-counties because generally vitamin A supplementation, like if we talk about Kandara Sub-county, it was below 30%, and now we are talking of 82% in both 6 to 11 and 12 to 59.
In 2017, the coverage for 6 to 11 months was at 62.1%, and the coverage for 12 to 59 months was at 75%. Since the project came in, 6 to 11 we've been able to achieve 104%, and for the 12 to 59 we've been able to achieve 134%.
The high figures are attributed to children from neighboring counties crossing over. Nurses are at the core of the success that has been registered.
I don't use force, but I use a positive reinforcement where I encourage them, I remind them the importance of vitamin A to our children. And the good thing is that many of them are parents. They are also having the small children, so they know the advantage.
Margaret Masharia is a nurse at Murang'a District Hospital. She knows, as other nurses do, that sickness and disease are not just medical issues. Good nutrition counts. Monitoring children's growth regularly may lead to early detection of nutrition-related conditions. Appropriate interventions could be employed to remedy the situation. Children under 5 years remain more susceptible to many illnesses.
Sasa tutampatia vitamin A. Vitamin A inakuwa ya maana sana kwa mtoto. Inaongeza kinga kwa mwili.
It's comforting for a mother to know and be reassured that her baby is progressing well.
We have the capsules that is in blue color, which is 100,000 international units, which is given to children of the target group 6 to 11 months.
Akifikisha mwaka tutabadilisha, tutampatia ingine ni ya red, ni ya kara red, hii inakuwa na nguvu zaidi.
The Murang'a County Government, Nutrition International and the Center for Behavior Change and Communication, CBCC Africa, have been working together in this drive.
Mtoto wako ninaona unamlisha mzuri, naona grafi yake iko mzuri, inaendelea on the road to health. Alipatiwa akiwa na mwaka moja, akiwa na mwaka na nusu tunampatia ingine.
An adequate supply of the blue and red capsules was maintained. The red ones of 200,000 international units targets children from 12 to 59 months.
Sikia tamu, sikia tamu.
If we strengthen especially the static facilities, because these are health workers are always there and they are available. The vitamin A is available because we get it free. If we can empower the communities to be coming to the facilities, the vitamin A supplementation will be readily available, and we have seen that if that one is strengthened, it can really help us get our coverage to 80%.
The static facility channel has seen different parents and their children respond well to this campaign.
They make sure they bring the children to the clinic, even those who are up to 59 months. Every 6 months, we tell them to come with their mother-child booklet with supplements, and we fill in the booklet. So you have seen an improvement. There is good uptake.
The integration has really helped us because when that child comes, we are not going to tell the mother, we will give you the rotavirus here, and then go for the vitamin A in another room.
Mtoto wangu ako na miezi 10, nafurahia sababu nilikuja kwa clinic nikapatiwa vitamin A akiwa na miezi 6. Na nikaelezewa umuhimu wa vitamin A. Inasaidia mwili mtoto asikuwe anapatwa na magonjwa kama homa, akuwe na afya mzuri, na ndarudi kwa kliniki akiwa na mwaka nipatiliwe vitamin A ingine.
For those who were unable to visit health facilities, there was another channel.
We also reached out to the kids at home through the community units. So we ensured that the CHVs could collect the vitamin A at the health facility and go door to door to give those children that are not in school.
Julius Macau has been a community health volunteer since 2007. He often goes to a health facility to collect some capsules to dispense. He might be given about 10 at a time. The nurse in charge of the facility documents the capsules Macau lives with. He's handed a tally sheet and a pair of scissors. Whatever capsules remain, Macau brings them back. Macau's primary mission is to visit the houses within his community unit, administering vitamin A and educating mothers on its importance.
Mimi huwa na shughulikia nyumba 127 ambapo kila nyumba ni average 5 households, ambapo tukijumlisha yote inakuja average ya 640 hivyo. Vitamin A ni dawa ikoragwo ikiheo ciana no kidawa gwo ikoragwo ciria ni muthemba wa irio ukoragwo urutitwo thiini wa irio iria turiaga ithui ugekirwo ta dawa nigetha cia guteithĩrĩria ukuria wa mwana meciria kimwiri hindi iria mwana arakũra.
As one of the counties in Kenya that have been having a low vitamin A supplementation coverage, Murang'a has witnessed a surge in uptake in the two sub-counties.
The low coverage was being contributed by children who are not in school and they are not coming for the routine immunization services. Mainly children above 1 year and before they go to school. That age was hard to get. And that is why the introduction of the service delivery through the community health units came in handy.
When a month ends, reports based on the different channels are compiled.
By collecting the data, by compiling the data, interpreting the data, you're able to tell where you are in terms of figure. In this, you're able to interpret how many number of children have been reached, how many number of children have been supplemented, and you can be able to tell the gap. How many are we supposed to go out and to reach there?
Lessons learned from both would be able to fit into the scenario of the counties that were not performing a little better and the counties that are performing poorly.
The evidence we are generating, we will share it widely in a document we are calling VAS Operational Plan.
It's hoped that other counties will learn vital lessons that will ensure children are given the early boost they require for normal growth. From July to December 2018, 1,793 children in Kandara aged between 6 and 11 months received the supplementation, while in Murang'a South, 2,209 did. These figures represent a coverage of 81.7% and 104% respectively. For children between 12 and 59 months, a total of 17,188 in Kandara and 23,314 in Murang'a South were reached, translating to 96 and 134% respectively.
We need to do much more than just supplementing the child. We need to engage stakeholders. We need to sensitize the caregivers. We need to sensitize the beneficiaries. We need to think about us as healthcare workers and engage every person within the health workforce, including the leadership, into the delivery of vitamin A.
We have tried to involve other stakeholders in terms of immunization and also vitamin A supplementation so that everyone becomes part of this agenda, so that when the donor goes, we are not going to suffer anymore.
We can prevent most diseases if we enhance our nutrition from the time we are babies.